Thank you for attending the Kentucky Public Pensions Authority Health Insurance webinar. During today's webinar, we'll have a high-level overview of the different eligibility requirements for health insurance at retirement. We'll go over the facets of the percentage-based and dollar contribution insurance plans, recent legislative changes, and eligibility for Medicare and non-Medicare insurance coverage. We'll cover qualifying event and open enrollment periods, and review reimbursement plans and insurance coverage when returning to work. We will cover a lot of information today, but we hope you find this information helpful. The Kentucky Public Pensions Authority offers health insurance benefits under certain conditions for our Medicare-eligible and non-Medicare eligible retirees and beneficiaries. At the very least, in order to obtain health insurance, the retiree or beneficiary must be receiving a monthly payment from KPPA. Depending on the retiree's participation date, KPPA may pay a portion of the health insurance premium, potentially up to the full contribution rate of the plan. It is very important for all of our members to know the changes that have occurred over the years to health insurance eligibility and how benefits are administered to our retirees. Many members are not aware that these changes have occurred. There are 3 tiers of insurance coverage. These do not align with the 3 different retirement tiers. The first insurance change was for members with an initial participation date on or after July 1st of 2003. For those participating prior to that date, KPPA offers a percentage-based insurance plan upon retirement. No service requirement is needed. The retiree only needs to be receiving a monthly payment to be eligible for the insurance benefit. What KPPA pays and what the retiree pays will be discussed later. For all members with an initial participation date on or after July 1st of 2003, there is a dollar contribution plan for health insurance. Unlike the percentage-based plan, there is a service requirement in place. Retirees must have at least 10 years of work service at retirement to be eligible for the health insurance benefit. Starting July 1st, 2026, there will be changes that we'll discuss in a few minutes. The next insurance tier was established in September of 2008. At that time, the service requirement changed for anyone with a participation date on or after September 1st of 2008. For those Tier 2 and Tier 3 members, 10 years of work service, or 180 months, are required to be eligible for any insurance benefit upon retirement. Additionally, Tier 2 and Tier 3 members pre-fund their health insurance benefits by paying in an additional 1% of their credible compensation into a health insurance contribution fund. There are also additional changes coming to this tier effective July 2026. As mentioned on the last slide, members who have a participation date prior to July 1st of 2003 are under the percentage-based insurance plan. This plan pays a percentage of the contribution rate towards the monthly insurance premium, and the remainder is paid from the member's monthly payment. For those with hazardous service, KPPA pays an associated percentage based on hazardous service for spouse and dependent coverage. For members with less than 4 years of service at retirement, they may obtain the insurance from KPPA, but KPPA will not pay any towards the plan. The entirety of the premium is paid from the member's monthly payment. For members with 48 to 119 months of service at retirement, KPPA pays 25% of the contribution rate. For members between 120 and 179 months of service, KPPA pays 50% of the contribution rate. For members with service between 180 and 239 months of service, KPPA pays 75% of the contribution rate. For members with 240 or more months of service at retirement, KPPA pays 100% of the contribution rate. What is the contribution rate? It is a monetary amount determined by our Board of Trustees that is typically associated with the premium of one of the Medicare or non-Medicare eligible plans for each plan year. Here is an example of the percentage-based plan. John Doe works in a non-hazardous position for an agency participating in KPPA and retired June 1st of 2022. He retired with 19 years of service credit, which equals 75% of the contribution rate. In 2026, the contribution rate for percentage-based retirees is $1,105.54. 75% of $1,105.54 is $829.16, which would be applied each month toward the single premium. The remainder of any premiums would come out of the member's monthly payment. Here's an example of the percentage-based plan with partial hazardous service. John Doe worked in a non-hazardous position for 10 years and 12 years in a hazardous position. He retired August 1st of 2025 with 22 total years of service credit, which equals 100% of the contribution rate for the retiree. With 12 years of hazardous service, 50% of the contribution rate for a spouse and dependent child would be paid. In 2026, the contribution rate for the Living Well PPO family plan is $2,453.16. KPPA would pay 100% of the single rate, which is $1,105.54. In addition to this, $673.81 would be paid for the spouse and dependent children. This amount totals $1,779.35, and the remainder of the premium would be paid out of the retiree's monthly benefit. For members whose participation date is on or after July 1st of 2003, a dollar contribution health insurance plan is offered by KPPA. For those whose participation date is between July 1st of 2003 and August 1st of 2008, a retiring member must have at least 120 months or 10 years of worked service to be eligible to participate and receive the health insurance benefits. For those who have a participation date on or after September 1st of 2008, 180 months or 15 years of worked service are required to participate in the health insurance plan at retirement. When established in 2003, it was determined that non-hazardous members would earn $10 per month towards insurance for each year of earned service. Hazardous members would earn $15 per month towards insurance for each year of earned hazardous service. The contribution amount is increased each year by a cost of living adjustment. Since 2008, the cost of living adjustment has been 1.5%. The monthly contribution rates for fiscal year 2025-26 are $14.85 non-hazardous and $22.27 hazardous. The monthly contribution rates for fiscal year 2026-27 will be $15.07 non-hazardous and $22.60 for hazardous. Here's an example of the dollar contribution-based plan. Jane Doe works in a non-hazardous position for an agency participating in KPPA and retired January 1st of 2025. The KPPA monthly contribution for the 2025-26 fiscal year is $14.85 for each year of service. She is retiring with 15 years of service credit. Beginning July 1st of 2025, the contribution rate will be 15 years multiplied by $14.85, which equals $222.75 per month. In July of 2026, the cost of living adjustment will be applied, which means that KPPA will pay a rate based on 15 years multiplied by $15.07, which is $226.05 per month. Any remainder of the premium will be taken from Jane's monthly benefit. Here's an example of the hazardous dollar contribution-based plan. John Doe works in a hazardous position for an agency participating in KPPA and retired January 1st of 2025. The KPPA monthly contribution for the 2025-26 fiscal year is $22.27 for each year of hazardous service. John retired with 20 years of service credit. Beginning July 1st of 2025, the contribution rate will be 20 years multiplied by $22.27, which equals $445.40 per month. In July 2026, the cost of living adjustment will be applied, which means that KPPA will pay a rate based on $22.60 multiplied by 20 years, which is $452 per month. Any remainder of the premium will be taken from John's monthly payment. Here's an example of mixed service with a dollar contribution-based plan. John Doe works for an agency participating in KPPA and retired August of 2025. He had 10 years of hazardous service and 10 years of non-hazardous service. The contribution rate will be 10 years multiplied by $22.27, which equals $222.70 per month for his hazardous service. His 10 years of non-hazardous service will be multiplied by $14.85, which is $148.50. A total of $371.20 is available to be used for insurance. Any remainder of the premium will be taken from the monthly payment. Recent legislative changes may impact the amount that KPPA pays for health insurance. Let's talk about Senate Bill 10, enacted during the 2025 legislative session. Senate Bill 10 impacts CERS members who are in the dollar contribution health insurance plan and not on Medicare. It increases the dollar amount KPPA pays when a member retires with service matching or exceeding the career threshold effective January 1st of 2026. CERS members will pay a health insurance contribution to help fund the insurance funds effective July 1st of 2026. This is in addition to the 5% or 8% employee contribution. Tier 2 and Tier 3 members already pay 1% of their credible compensation. Starting July 1st of 2026, all hazardous members in the dollar contribution plan will pay 2% of their credible compensation. The insurance contribution rate for the CERS retiree will increase if the retired member reaches the career threshold in service at the time of retirement. Secondly, the retired member cannot be eligible for Medicare. The career threshold for non-hazardous service in all tiers is 27 years, or 324 months. The career threshold for hazardous service is 20 years, or 240 months, for Tier 1 members, and 25 years, or 300 months, for Tier 2 and Tier 3 members. If the career threshold is not met at the time of retirement, the retiree will receive the lower monthly contribution based on the original amounts plus cost of living adjustments. CERS non-hazardous members who reach the career threshold in service before retirement will have the dollar contribution amount of $40 per month for each year of service. CERS hazardous members who reach the career threshold in service before retirement will have the dollar contribution amount of $50 per month for each year of hazardous service. The increased dollar contribution amounts will be subject to an annual cost of living adjustment. The current increase is 1.5%, and it occurs each July 1st. CERS members who reach the career threshold in service and receive the increased monthly benefit can apply the extra benefit toward a non-Medicare plan. Once the retiree turns 65 or becomes Medicare eligible, the monthly contribution will resume to the non-enhanced amount. The retiree will receive the lower monthly contribution based on the original amounts plus COLAs. Here's an example of how Senate Bill 10 impacts a CERS retiree. A CERS member with a participation date of August 1st of 2004 retires with 324 months of non-hazardous service on a non-Medicare plan. As the career threshold for non-hazardous service has been met, KPPA will pay $1,080 towards the monthly health insurance premium. That works out to $40 per year times 27 years. The $1,080 monthly amount will receive annual COLAs each July beginning July 1st of 2026. Here's a hazardous example. A CERS member with a participation date of August 1st, 2004 retires with 252 months of hazardous service on a non-Medicare plan. As the career threshold for hazardous service has been met for a Tier 1 member, KPPA will pay $1,050 towards the monthly health insurance premium. This equals 21 years multiplied by $50 for each year. The $1,050 monthly amount will receive annual COLAs beginning July 1st of 2026. The second aspect of Senate Bill 10 is the pre-funding of the insurance funds. All CERS members in the dollar contribution plan who are not already paying into the health insurance fund will begin to do so. This does not impact KERS or SPRS employees or any employee on the percentage-based insurance group. Tier 2 and Tier 3 members have always paid a health insurance contribution. Tier 1 CERS members with the participation date on or after July 1st of 2003 will be impacted. Effective July 1st of 2026, CERS non-hazardous employees will pay 1% of their credible compensation into the health insurance fund, and hazardous employees will pay 2% of their credible compensation into the health insurance fund. This is in addition to the 5% or 8% employee contribution, which is paid into the pension fund. The health insurance contribution is a non-refundable pre-tax contribution. Additionally, Tier 2 and Tier 3 hazardous CERS employees will begin to pay 2% of their credible compensation into the health insurance fund. Currently, that contribution is set at 1%. If you are not on Medicare when you initially apply for coverage or during any enrollment, you must declare if you or any dependents have used tobacco products in the last 6 months. Tobacco is defined as any tobacco product, including but not limited to cigarettes, cigars, pipes, chewing tobacco, snuff, and any other products regardless of frequency or method of use. If you or the dependent on your plan has used tobacco in the past 6 months, there is an associated fee. For single coverage, the monthly fee is $40. If utilizing dependent coverage, such as couple, parent plus, or family, even if only one person has used tobacco, the monthly fee is $80. When initially enrolling or during open enrollment, the Kentucky Employees Health Plan requires that all non-Medicare enrollees take the Living Well Promise. The Living Well Promise must be completed between January 1st and July 1st of each year. To complete the Living Well Promise, the retiree must complete an online health assessment. The health assessment and wellness vendor is Castlight. You can learn more by going to Castlight's website at mycastlight.com/mybenefits. Failure to complete the Living Well Promise will result in a $40 monthly fee added to the health insurance cost in the next calendar year and is paid by the retiree. Non-Medicare eligible KPPA retirees will have the same qualifying events that you had while you're employed. So if you return to employment and pick up new coverage or lose coverage, or if you should marry, divorce, or have a child, etc., contact KPPA so that we can send you a qualifying event packet. Make sure to do it as soon as you know of the change, as many qualifying events have deadlines. KPPA may require additional documentation as well. When a member is over age 65 when they retire, they will be eligible for Medicare and a Medicare-eligible plan at retirement. If a member turns 65 or goes on to Medicare after retirement, they will transition to the Medicare-eligible plan the month of their 65th birthday. The plans offered by KPPA are designed to coordinate with Medicare Parts A and B, so it is important that you contact Social Security to make sure Parts A and B are effective the month of your 65th birthday. Medicare Part A is provided to retirees at no cost.
You have paid for it with Medicare taxes while you have been employed. Part B does have a monthly premium, which is typically taken from your Social Security check. Retirees should contact Social Security 3 months before age 65 to set up Medicare benefits. If a member does not sign up for Medicare when eligible at age 65, there may be a late enrollment penalty. About 6 weeks before the month you turn 65, KPPA will send you a packet that will have your materials for the Medicare eligible plans. We will need a copy of your new Medicare card showing your Part A and Part B eligibility dates. The monthly premiums for the Medicare eligible plans are much lower than those for the non-Medicare plans. KPPA will still pay the same percentage or dollar amount towards the monthly premiums that were paid on the non-Medicare plans. 2 of the 3 plans offered by KPPA cover both medical and prescription costs, which are Part D plans. The third plan is medical only, which means there are no prescription coverage options through KPPA.
Here is a listing of the available Medicare eligible plans for KPPA retirees. The medical-only plan is just that. It covers hospitalization and medical costs not paid for by Medicare A and B. The KPPA Essential and KPPA Premium plans are Medicare Advantage plans and include insurance coverage for prescriptions. The 2026 contribution rate for those on the percentage-based plan is based on the KPPA Premium monthly cost, $199.94.
KPPA retirees on the Medicare plans have the opportunity to add or drop dependents or change level of coverage due to what are called special enrollment periods. Medicare eligible retirees should contact KPPA for details if one of these events should occur. KPPA retirees have an open enrollment period each year for the next calendar year plans. At that time, the retiree has the option to change plans or add or drop dependents. The non-Medicare plan usually runs the month of October, and the Medicare plans are later, typically the last week of October through a deadline of November 30th. Please pay attention to the open enrollment materials, as often the enrollment is non-mandatory, meaning no documentation is required to continue the same level of coverage. Please note that hazardous retirees with dependent coverage must always complete a Form 6256 every year, even if the enrollment is non-mandatory. Retirees in the dollar contribution plan have a new option beginning January of 2023. Retirees who have a participation date on or after July 1st of 2003 are eligible to have the option of receiving reimbursement for out-of-pocket premiums if they choose to obtain insurance from another provider or employer. Recipients eligible to participate in the dollar contribution reimbursement plan will be reimbursed up to their individual applicable monthly contribution rate for premiums paid for hospital and medical insurance coverage, less any premium paid by the members or members' spouses, employer, or other state-administered retirement system. Documentation is required to obtain the reimbursement amount. Tier 1 KPPA retirees who return to employment with a participating agency have the option of keeping insurance coverage with KPPA or taking insurance with the employer. If the retiree chooses to keep insurance with KPPA, KPPA will bill the employing agency the contribution rate for the insurance coverage. If a Tier 2 or Tier 3 retiree returns to employment with a participating agency, they must enroll with the employer's insurance plan. KPPA cannot offer flexible spending if the retiree chooses the employer's insurance. If you are Medicare eligible and wish to return to work, please contact KPPA to make sure that your insurance and Medicare are properly coordinated. We are asked a lot of questions about health insurance because it is obviously a large part of life after retirement. Here are a few of those frequently asked questions. How do I initially enroll for insurance? You can enroll for insurance online in Member Self-Service when you file for retirement. The last step in the online retirement application is to file for your insurance coverage. If you do not file at that time, you'll be directed in your retirement packet to do so. Open enrollments are also electronic via Retiree Self-Service. A link to the Open Enrollment module is available during the open enrollment periods. I've been told that I will receive free insurance for life when I retire. Is that true? While retirees with a participation date prior to July 1st of 2003, retiring with greater than 20 years of service, receive 100% of the contribution rate, that does not guarantee the premium will be provided at no cost. It may be that there is a plan that has a higher premium that is not covered by the contribution rate, or you may have dependents on your plan that are not covered. Additionally, you may have to pay Medicare Part B premiums. I'm hazardous duty, and I've been told that I can keep dependent children on my plan until age 26, but KPPA does not pay a contribution after they turn 22. What is the difference? There's a statutory definition of what a dependent child is, and it states that the maximum age for a dependent child is 22. Health insurance law states that a child can be on a plan until age 26. So you can still cover your children as dependents, but the hazardous coverage that KPPA pays ends at age 22. What exactly is a dependent child? Kentucky Revised Statute 16.505, paragraph 17, defines dependent child as a child in the womb and a natural or legally adopted child of the member who has neither attained age 18 nor married, or who is an unmarried full-time student who has not attained age 22. This is only part of the dependent child statute. For a full reading of KRS 16.505, please visit legislature.ky.gov. I received notice in my open enrollment notification that it is a non-mandatory enrollment period. Do I have to do anything to keep my coverage? Typically not. If the open enrollment for the next year is a non-mandatory enrollment, you do not have to complete a new application. KPPA makes it very clear in all of our materials, on social media, and our website when and if a new application is needed for the next year. That being said, hazardous retirees always have to complete Form 6256 every year to verify any beneficiaries that are being covered on their plans. Do service purchases count towards health insurance benefits? Law changes impacted how service purchases work towards health insurance eligibility. If the purchase was made prior to August 1st of 2004, the purchase service does count towards health insurance. If purchased after, it only helps in the retirement calculations. There are some service purchase types, such as recontribution of refunds, omitted, and hazardous conversion, that will always count towards your health insurance coverage. Does KPPA offer flexible spending plans in lieu of insurance coverage? No. KPPA does not offer any benefits in lieu of the coverage. If you do not take the coverage as a result of being covered elsewhere, there is no monetary compensation. If my monthly insurance premium is less than the amount KPPA pays towards the coverage, do I receive that extra money? No. KPPA does not offer any monetary payment for taking a lower cost insurance plan. Our legal notice concludes the health insurance webinar. This presentation, of course, is intended for general information reference only. So if you do have specific questions regarding your account, please contact us at 1-800-928-4646. On behalf of myself and the other KPPA staff, we thank you for attending today's webinar, and have a great day.